It's a really nice point to segue onto some barriers. So looking at what are potential barriers to prevent progress, prevent innovation, and sort of break down these relationships. Sheela, I want to come to you first because I know the ABPI code comes into play quite heavily when industry works with various stakeholders. I know this is something you're very passionate about. Can you just talk us a little bit about how this is impacting public-private partnerships in particular?
Thanks, Nicola. Yes, I have got a little bit of a bee in my bonnet about this, and I have written a short article for Rare Evolution on it. I think for me, I totally understand why the code needs to be in place. So I'm not saying that the code is wrong or it shouldn't be there. You know, it's good to have a clarity and understanding of how the industry should work with charitable organisations, patient organisations and others. And we need to create a kind of level of transparency, which is extremely, extremely important, particularly as we touched on the perception piece earlier. And we've also seen I think about 6 or 9 months ago in the media, this kind of frenzy about patient organisations being funded by industry, and therefore if they're funded by industry they're going to be advocating for the new therapies when there are discussions around reimbursement and access to these therapies. So I think it's really important to have this code in place so that we can be sure about the interactions, how the interactions should be undertaken, and what's a kind of an appropriate interaction, and how these constructs need to be put into place. However, my worry or my concern about the code is whilst it provides a really good framework, it also provides a massive barrier because overzealous compliance teams who have no idea of the practicalities of these partnerships have no appreciation that a large number of our rare disease patient organisations are very small. You know, they don't have the capacity, because often they are, as you say, I think Nadiah, you might have mentioned this, you know, these are people doing this in their spare time, which is very, very valuable because they're doing 100 other things, primarily caring for the person with the rare diseases or have a rare disease themselves. And so they don't have the capacity, they don't, and I mean this in the most respectful way, understand the complexities of the code, or should have to understand the complexities of the code, because that's not their job. So you get into a situation where companies are wanting to collaborate and work together, so they kind of instigate a project and everybody gets really excited and the paperwork is put together, and it's like a long list of do's and don'ts that actually, if I'm really honest, are unpenetrable. You can't understand them. You don't know whether you should be colouring this box in blue, green, red or yellow. And if you do it, you're worried that you're going to get into trouble by some person who's going to have this kind of I love this idea of, you know, this kind of arm's length kind of reaching out and suddenly giving you a right big slap. And that's not something that patient organizations really should be worried about. They shouldn't have to suddenly try to buy in legal expertise to run through this 500-page contract that's come through that actually means absolutely nothing to them. And then what happens is patient organizations go, oh, no, thank you. And actually, it's kind of thrown this fantastic idea and opportunity of a public-private partnership and collaboration out of the window. I think that my article talked a little bit about the fact that it's not meant to be like that. You know, lots of people assured me, the ABPI and the kind of organisations that regulate them said, oh, it's not meant to be like that. It's just meant to be a guide. And I said, yeah, but if people interpret it as law, which it seems to be interpreted as, then you're getting into a situation where even if these partnerships could be fruitful, they're stalled at that first hurdle. So I think that we need to find a more pragmatic approach that provides a framework for these collaborations. This is some of the things that we've been doing in Together for Rare, like trying to think about what are the key components, you know, what are the standard clauses? What do those standard clauses mean? what does
And
it mean
removing
when we
that
say,
ability to translate it differently, it shouldn't be something that everybody has their own interpretation of.
yeah, it's like any legal contract. None of it. How many people, when you sign up to a website, read the small print? None of us, I would say a large majority of us don't, because if we did, we would not be signing up to half the websites and half the newsletters that we receive in our inboxes every day. And it's a similar thing. Why should we expect the patient organizations, and let's be honest, I challenge Eric from an industry perspective, how many of those contracts he actually understands, and how many pieces of lines in those contracts that he personally could go, actually, I don't think I can do this, or I'm worried about, saying to Nadiah, so I think that we need to be mindful of the transaction that we're trying to undertake, be more measured in the types of conversation and documentation that we're sharing. And I think we need to remember that there are people on the other side who are very educated, very capable, probably in, we forget that patients or people living with rare diseases are not should not be defined by their rare disease. So they could, they could be having jobs, they could have education, they could be perfectly capable, but my goodness, they see one of those documents and they all just want to hide and go, I don't think I can deal with that, because I am worried if I put the full stop in the wrong place in this sentence, I'm going to get in trouble. So I do think that we need to find a way to translate the code into a more operational, understandable structure, so that when organizations like Eric's pharma companies go to organizations like Nadiah and go, we'd like to collaborate, we'd like to develop a public-private partnership, it means 5 things. We will do this, we will do that, we expect you to do this, we expect you to do that. We need to be careful, a bit like we said, that you mustn't talk about treatments, you mustn't talk about individuals, you mustn't share competence. It's very basic stuff. That's exactly what they're saying. They just say it in 500 pages instead of saying it in 3.
I really
so
appreciate
that's my frustration. I think let's make it translatable, let's make it understandable, let's put it in plain English, because God knows, you think the patient organizations don't understand it. I think people working in industry don't understand it either. No. It's just the compliance teams trying to put this jargon behind lots of complicated pieces of information that make them look like they're important and that they need a role in this place. Absolutely. Very strong. But
so Victoria, I want to come to you kind of piggybacking off of that idea. Obviously there's a lot of it's quite intimidating. There's a lot of sense and perception of risk, perhaps on both sides there. What do you feel can be done to kind of lower that sense of risk, to entice people who might be otherwise really intimidated to engage in a partnership, either from industry or from advocacy?
Yeah. I think, well, Sheela's covered nicely the sort of UK example, and that expands elsewhere. And again, looking at the Together for Rare Disease work, when we think about the European reference networks and trying to untap their potential as networks to do more research. I won't go into the full story, but there's an executive body that's kind of in charge of the ERNs. It's an interesting situation where they don't have a sort of legal say on some things in terms of what the networks can and cannot do. But, statements that they've issued in the past have been tremendously prohibitive, have really formed the sort of physical wall that, if you're from a community, a rare disease field that hasn't typically worked with industry, it really puts people off. Because there is, I think that I really, that resonates with me, that Sheela's mention of there's a constant feeling that you're going to somehow fall foul of something and be told off. And just picking up on other questions in the chat there, what's needed to dispel the negative impression. I think we do need more more supportive and more positive sort of national messages, more policy messages to say actually from policymakers that this is okay. This comes with another side as well, though, which is, it's all very well for me to say to group of academics or to a patient group, it's something that you shouldn't be so concerned about. It's a really good thing to do. there are people out there who have been very much burned by particular companies in the past. And the problem is when something goes wrong, it really goes wrong. And when there's an abuse of power, or what's perceived to be an abuse of power, or financial practices that are less than ethical, the impact on the wider community is enormous. So there's also, I think, as there is for all of us in our daily lives, companies do need to be really cognizant of their responsibilities to make sure that what they're doing is at the highest possible ethical standards. But having said that, I think we do need more kind of, as well as the policies, we need more practical opportunities to foster this. So, third-party organizations that can provide support and advice to patient organizations, to academics on how to get involved in these sorts of things. If they can offer, I answered a little bit in the chat there about standardized contracts and trying to break through some of the jargon. I think, that kind of practical support's really, really important. I think we need more sharing of case studies in a better and prouder way, because often where people do, work with a company, it's a little bit more hush hush, and we don't shout loud and proud about it. And we should do, actually. We should be sharing the fact and learning in the disease areas that have got less interaction with industry to date, just because there's been less attention on their conditions. Learn from those that are out there. They will tell you not necessarily what to do, but they'll also tell you what not to do. So I say this all the time, we need to copy as much as we can in the rare disease space, whilst also, as the other colleagues have said, looking outside of that where it serves our purpose, leveraging the more common conditions, so the more common neurodegenerative conditions and the expertise in those communities to address the more rare neurodegenerative. So I think when you're in rare, you have to always think about what's unique, what's special, but also where you can sort of, capitalize and leverage on these larger movements and larger groups. But share what's happening and provide as many practical resources and toolkits that you possibly can.
Brilliant. Thank you, Victor.